Welcome to The Exhale, a podcast for ambitious women who are ready to stop running on empty and start leading from a place of calm, confident clarity. I'm your host, Marina K, executive coach, breathwork facilitator, and founder of Women Who Breathe. And each week, we host conversations that make women's lives easier. We help women end cycles of burnout through holistic health and leadership coaching. This is your space to slow down, take care of yourself, and remember who you are underneath all the doing. You've been holding it together for everyone else, and you deserve to finally exhale. Hi, everyone. Welcome back to the next podcast episode for the Exhale podcast. And for this episode, I'm joined by Brittany Morrison, and we're going to be talking all about women's cardiovascular health, which is such an important topic. And before we dive into it, I connected with Brittany. I saw you on a women's health panel here in Austin, and I was just so moved by her story.
Thank you.
It was really something that hit home for me personally because a big part of your journey has been getting the right diagnosis and all of the challenges you went through in getting the right diagnosis with your heart health. And it's so close to home because I've seen and heard and had friends, so many women get dismissed in the medical establishment, which we're so grateful for. And there's, I think, so much opportunity for women to really be listened and heard and supported because women's health is so unique.
Yes.
That's one of the things that, I'm really passionate about talking about is how unique women's bodies are.
Mm-hmm.
We'll talk about how unique women's hearts are
Yes.
and why we should be paying attention to heart health in women specifically.
Mm-hmm.
It is different than male heart health. And of course, the part around how much research is missing in the women's health space. So I was so touched by all of that. I think I immediately came up to you and I was like, I'm filming the show in a few months. I'd love to have you. I didn't have anyone on the cardiovascular topic. So this just felt so perfect to make sure that our women feel supported. So I'd love for you to just start by introducing yourself and what you do, and then we'll jump into your health journey.
Absolutely. And thank you so much for inviting me to do this. I always jump at the opportunity to talk all things women's cardiovascular health because it is so near and dear to me personally, but because I also, through some of the storytelling and advocacy work that I've done, I've had so many women reach out to me looking for answers, and men too, actually, and have been able to inspire people to put themselves on their to-do list and really, go get that checkup and go get those labs drawn and just be proactive in their health. So I always say this is a quick yes for me. I guess in my day-to-day world, I am a philanthropic advisor. My company is Bespoke Advisory. And essentially what I do every day is help people match their intention to do good with the impact that they make. So I bridge that gap for people who may not know how to navigate that landscape as an expert and help them realize those goals more effectively.
That's beautiful. And we share that in common. I have a passion for philanthropy. We'll talk about that another time, maybe.
Yes,
when
for
we
sure.
can connect, because I definitely want to understand, your world there better. I'm very, very moved and passionate just about philanthropy and women's work and just, getting good organizations the support that they deserve to move the needle forward for all of us. So that's so
I would
important.
love to talk to you about that.
Yeah,
so
absolutely.
I'm working on a big project too.
Oh,
so
amazing.
I can tell you about it.
I hadn't mentioned this before, but I did some volunteer work in Ecuador with some women's health organizations there, and I studied midwifery and just a number of different things. Yeah, so I hope to circle back to that part of my life later on.
I would love that.
Yeah. So lots to connect on there. But I'd love for us to really understand your health journey. And maybe if you want to first begin with what is your current diagnosis, right? What you've uncovered for yourself throughout the past, I think it's been over 3 years, right? Of this journey, maybe slightly
4
longer,
now.
4 years
Yes.
of really getting the right diagnosis. And if you could share that with us, and then maybe just a high level before we dive into all the details of what it's looked like for you, getting those answers.
Yes. So I'm happy to report that today I am the most stable, vibrant version of myself that I've been in several years. I first started experiencing what I now know to be cardiovascular related symptoms in 2021, 2022. And I had my first heart attack in February of 2022. I had my second heart attack on Mother's Day in 2024. Those were caused by two different things. And the first was caused by a blockage in my LAD, which is also referred to as the widowmaker artery. It's one of your most important vessels in your heart, and it was almost completely narrowed. And then my second heart attack was caused by a condition called coronary vasospasm, which is less known, less studied, much more difficult to diagnose. And it is kind of this complementary condition to another one that is more common in women called microvascular disease. And they're definitely learning more about it now and talking more about it. But I feel like when my issues started, it was kind of like right on the cusp of those conversations starting to happen. And I was a head scratcher in most medical settings and environments. I mean, my blockage alone was quite unfathomable to my medical teams. And so I will say that I've gone through a very, very long, arduous process of receiving the proper diagnoses over the years. And it really wasn't until the summer of 2024 that I was actually diagnosed with the coronary vasospasm condition. And that was a big turning point for me. And then there are some subsequent things that I have run tests on, and we'll talk more about that later. But from a holistic perspective of me as a whole person and as a woman, and some medication therapies and things that have actually like really impacted me for the better in my cardiovascular health that wouldn't have come necessarily from the cardiology space. So again, the last time I was in the emergency room was August 11th or 12th of 2025, and it is the longest I've gone to date since February of 2022 without seeing the inside of an ER. So we're just going to keep that streak alive, and it allows me to keep having conversations like this.
Yeah. Well, I'm so glad that you were able to get the right care. And I think it's important to also mention at the outset of this conversation that you're young, you're in your 30s.
Yes.
And otherwise, these heart conditions that we hear of, like from poor diet and lack of exercise, right? That really wasn't the case with you.
No, I was 32, 33. I'm 37, almost 38 now. And so, yes, I was very young, which was part of why I struggled to be taken seriously. I'm 5'5". I'm like a little person, I'm very active, and I look like the picture of health.
Yeah.
I was exercising 4 days a week. I eat like salmon and broccoli and brown rice, and the complete antithesis of what you think of when you think of a cardiovascular patient. And most people immediately go to like an overweight older man. That's what they think of. And I don't know why. That's probably an unfair stereotype. But they don't think of a healthy, vibrant 32, 33-year-old single mom who's working and exercising and sitting on boards and living her life.
Yeah.
So it's really, I think, helpful, and also at the same time jarring, because people can see themselves in me. They can say, oh, wow, like I'm like her. But then it scares them because they're like, well, that could be me too. But I think it precipitates conversation that should be had around how we can be proactive to prevent these things from happening to us unexpectedly.
100%. Yeah, I think that's why it's so important to mention, because a lot of the conditions that, we often talk about and that we'll be exploring on the show, there's a certain stereotype that we think of when we think of that condition. And again, I'll come back to how it's so unique for women. Even like the widowmaker artery, I've heard of multiple men who I'm either acquainted with or are husbands of women in my life who have had a cardiac event because of that artery, and I've never heard it mentioned in the women's case.
Yeah.
So that's really important to mention. Before you had that first heart attack, were there any signs that were telling you something was wrong?
Oh, yeah. Oh, yeah. And the amount of time I spent like trying to talk myself out of them. I mean, I really knew something was wrong, but you really try to rationalize and explain things to yourself. You know, I'm just tired, or I stayed up too late, or I'm just pushing myself too hard. But things were getting to a point where I started to seek care. I was unable to carry out everyday tasks. Moving the clothes from the washer to the dryer became an exhausting task. I would be completely exasperated. Getting my feet on the floor in the mornings just to get out of bed. I would wake up and start crying because I felt like I'd been running I was so physically tired, I can't even explain it. I felt like I'd been running a marathon all night, and I really just didn't know how I was supposed to like get up in the mornings, but I did. And I went to work and I did all the things and carried out all my responsibilities and even had some fun. But it really started to get in the way of me doing the things I loved. I'm a very social, extroverted person. I've always worked in business development and fundraising and those types of roles. And I mean, I was at home on my couch. I could barely even really engage because I was so short of breath. To carry on a conversation would be challenging for me. And I was having difficulty exercising as well, which was pretty new for me. But it's funny, I talked about this at the event where I met you. I would be wearing my Apple Watch during exercise and it would be like 220 heart rate. And I would think, wow, that can't be right. You know, and I would even text people and be like, do you think that's concerning? Like, should I go get a second opinion? Like, should I go get a doctor's opinion? Oh yeah, you totally should. And I was like, nah, it's probably just my watch isn't calibrated correctly. Even though I would be struggling through the workout or feeling a little bit of chest pain. And then it got to the point where my heart rate was actually really low and very volatile. And I was struggling to stay awake. It was like it was below 40. Wow. And I was afraid to fall asleep. And so there were a lot of things that were going on. I was almost passing out at work events, like standing up at things. So it definitely got to a point, but I was seeking care. I was going to the doctors and I was saying something is wrong and I don't know what it is. I had COVID about 7 weeks before things really escalated. And I think that it was a bit of a catalyst because it compromised my immune system and I couldn't come back from it. I was already having those issues. Yeah. And the blockage was there before that. But I think it was kind of a bit of a nail in my coffin, if you will.
Yeah. And then through those two heart attacks, on the panel with you at the event I met you was Dr. Giesler, who seems incredible.
She is. She's incredible.
So do you want to just walk us through like the journey, you know, through that first one to the second heart attack and then to finally like getting the answers that you were looking for?
Sure.
For why that was happening.
So I was seeing one of Dr. Giesler's colleagues here locally, and he was really my primary point of communication. After I had initially gone into the hospital following my first heart attack, he was really following my care. And I saw her earlier on. So I saw him in February of 2022. I was not taken in for catheterization until mid to late April. So for 2 months, I was going through all kinds of testing because, again, it'd be unthinkable and unfathomable that I have a blockage or I've had a heart attack. It's more reasonable to think that I'm exhausted, I'm nervous and anxious, and I'm overdoing it. Yeah. Or there could be some other issue somewhere else. So all of my testing was coming back normal, with the exception of my stress test, which was abnormal. And my EKGs, my echocardiograms, my lab work, everything came back normal. I saw Dr. Giesler early on, and, you know, she was concerned, but she was like, you know, your tests are normal. That's a great sign. And, just keep in touch with us. Let us know how things are going. And in the meantime, things continued to kind of decline for me. I was in touch with my other doctor, and he ordered a CT scan with contrast. And once they did that, they were able to see that I did have early onset cardiovascular disease, but it didn't reveal how much, like the true gravity of the situation. So that ultimately ended up leading me to trying out some different medications. As I said, my heart rate was getting really low. Things were becoming pretty dire for me. I mean, I was so afraid that I was going to die. I would put my daughter to bed, sit on the floor outside of her door and cry because I just thought I'm going to leave this earth and it is far too soon. And my mom died when I was 22. And so I think I know what that feels like, to lose your mom. And I was so afraid of that happening to her. And it definitely put a little fight in me, obviously. But I called back to my doctor's office and I said, I can't live like this. Cut my chest open if you have to, but I am telling you, like, there is something wrong with my heart. And he said, I just want you to see Dr. Giesler one more time because it's a somewhat invasive, yes, it's a routine procedure, but I don't want to put you through it. I want her to get her eyes on you. And so I went in the next day and she was ultimately the one who said, oh, you have a lot going on. Like, let's get you to the cath lab. I mean, she looked at me instantaneously and I just started sobbing because I could feel her empathy. And I felt so seen in that moment of like, I'm not crazy after all. Like, you see that I'm struggling here. And so then they did that in April and discovered the blockage, put a stent in, and they thought, okay, like you're going to be fine. That wasn't the case. I continued to have a lot of issues from April of 22 up until really last year. And Dr. Giesler was involved with my care. She stepped away from practicing for a little while before she opened her new practice here in Austin, her private practice. So I continued to see my cardiologist who I'd been working with alongside her. And in addition to him, I saw dozens of others. I mean, Houston, other surrounding cities near Austin. I went to Cleveland Clinic after my second heart attack on Mother's Day in 2024. And that was really where I started to get some answers. So, one doctor may not know everything. And research hospitals can be different than other types of hospitals. And, you really, it's like, it's shopping around, truly. And I think when you're not satisfied with the answers that you're getting, or you continue to feel like you're declining and there aren't solutions that are available, you're left with no choice. Either you just accept that you're declining or what,
And something you touched on when I heard you speak was this term worried woman.
Yes.
And I've heard this before in the ER, in the medical setting of, a woman shows up and she's presenting certain symptoms and you run the labs and the labs come up normal. And then what often happens with women is it's discounted to being anxiety or just having some sort of a panic event when the reality is that the woman is having a real cardiac event. And I think I saw something like women are, I want to say 7 times more likely to be sent home without the proper labs and testing or the proper solution when they're actually having a heart attack because people assume that it's some sort of an emotional problem. Yes. So were there any moments like that, like on that journey of going to all of these different clinics and doctors where you felt like maybe someone wasn't believing you? I don't know if that's the right way to put it.
Oh, yeah. I mean, countless times. And really, I went into the hospital over a dozen times. I had over a dozen emergency room stays in a 3-year period. I had 7 cardiac catheterizations in 3 years. I think I had 4 in 1 year in 2023, maybe 2024. And so like family and friends were starting to really have a front row seat to this experience. And there's a lot that no one has seen that I have endured because I'm a single mom and, any single person. Like there isn't someone really around to witness your life, right? You are navigating it and holding it. And when I would go into the hospital, I would be scared. And the amount of times I would have to explain myself and explain my history and reiterate to a doctor, look them dead in the eye and say, I am a early 30s heart attack survivor. I have a stent in my LAD, and you're going to stand here and tell me that I'm just anxious? Do you think I want to be here? And interestingly enough, I would somehow always land in the hospital on a holiday weekend. I don't know why. I had a knack for it. And it's like, do you think I want to spend like 4 days here? Do you think I want to have these procedures? Like, I'd rather be at home with my daughter or with my friends. And I think that it got to the point where like my friends and family were just like aghast at how dismissed I was. And it was both male and female doctors. I don't want to say it was unique to male doctors. Are they a little worse? I think yes. At jumping to the anxiety, are you depressed? Are you what's going on at home? Like those kinds of things. When in reality, I look at them and I say, I'm stressed because I'm sick.
Yeah.
I am anxious because I am scared of the reasoning of why I'm sick. And I'm panicked because no one can solve that problem. So while all of those things can be true, you're not addressing the root of why I'm here.
Yeah.
You're addressing a symptom.
No, that's so important to mention so that women who are maybe on that journey right now, who are advocating for themselves and are coming up against a lack of answers, know that whatever you feel in your body is what you feel in your body. No one knows better than you what's going on, even if you don't have the right answer or the label for it yet. I see this in the endometriosis journey with women for so many years, finding those answers. I think on average it takes also like 5 years to get an endometriosis diagnosis, which I think is just shocking in 2026 that that's the case. And so, yeah, I think it's so important that, you know, you're sharing this now so that women who are maybe starting to feel like, okay, am I the crazy one? Know that that's not the case. Once,
let me just add, you know, I think you learn through these journeys. I mean, when this first started, I would myself was in doubt, and I would walk into the emergency room and be like, you know, I was a little nervous to be there, but I didn't like have a commanding presence at all. Then once I had enough experience and I was like an alumni of the hospital, I would walk in, and this last August, it's what I did. I said, I am a heart attack survivor. I am having chest pain. I need an EKG right now. I've already called my doctor. He knows I'm coming. And I tell you what, they move you right on back. Wow. And women are more likely to experience longer wait times in hospitals, more likely to be sent home without a proper diagnosis. So you have to really learn how to demand what care you need or ask for the care you think you need in a way that shows authority, not questioning. You might not know, but if you suspect, this might be happening. I want you to run the test for this. I want you to run my labs. Can you please do an EKG? Because, I mean, if they say no to you, that could be a difficult situation for them to get in. So it's one of those things where learning how to show up for yourself is important. It's unfortunate that it takes iterations, but I think through these conversations, maybe we can help empower women to be more confident in how they're showing up in those settings and not get pushed to the side of the waiting room, and to go up and advocate for yourself and say, I really need to get back there right now.
I love that. I love the approaching this space with authority. I think a lot of people in general have trepidation in the medical establishment, right? Because we're not experts in this field, but you are an expert of what's going on in your body, and you are an authority and in charge of your body and how you're feeling. So I love that, like really being frank when you're there and advocating for yourself. That's really, really important. When it comes to focus, most women don't need more stimulation. We need a brain that can actually keep up with the demands of the day. This is why I'm so excited to share that the first season of the Exhale podcast is sponsored by Wisby Genius Strips. They support focus, clarity, and mental speed, helping you stay consistent and sharp throughout the day. What I love most is that they're caffeine-free, which matters, especially for women, because we know that women's bodies and our hormonal ecosystem are much more sensitive to stress and to overstimulation from caffeine. Genius Strips are built with clinically studied ingredients at effective doses. They're ultra thin, fast release strips that you can take anywhere, and you don't even need water. They just melt in your mouth and start to work within 30 minutes to deliver the focus that you need. Designed by a neuroscientist and built for daily use, most people start with a 30-day supply. And right now you can get 15% off with the code EXHALE15 at checkout at wisby.com. That's WIZBE.com. Once you really started to dive into the cardiovascular space and looking for answers, right? I wonder what else you learned along the way that's unique to women. One of the things that I'm fascinated by when I was preparing for the episode was just knowing that, for one, women's hearts are smaller than male hearts. So just like right out of the gate, I'm like, well, that's a structural difference, right? There's going to be another episode where we talk about the brain differences of female brain versus male brains. And
Are our brains bigger?
I think
I'm teasing.
It's about the connectivity there, right? And actually, since you're a mom, I'll touch on this topic now because I think it's also so underappreciated. The term matrescence, right? The becoming of a mother. Most mothers don't even know what matrescence is. They've never heard that term. So matrescence, there's even a book on it. And it is one of the most structurally meaningful changes that the brain undergoes ever in any human's life. So we have puberty, and then second to that is matrescence. So a woman's brain changing postpartum. And I like, whenever I hear that, I'm like, I want to know more. What do you mean? That's so interesting. And so I think that leads into things like postpartum depression and how little we know there. And right, like these are structural changes that we can actually measure on a scan. And so going back to the heart, women's bodies are usually smaller. So smaller hearts mean it's a different, type of organ, and there's different arteries, and, you'll speak to this. I know you had shared how some of our arteries are much smaller than a male heart. I wonder what else you just learned along the way about like these male-female heart differences.
Well, I will loop back to what you were just saying about the different stages in a woman's life. So we are more complex in many ways than men because we have these different, peaks and valleys hormonally. So we do go through puberty. Then we may undergo fertility treatments if that is something that you need to do. And then you have your pregnancy, which is a very critical time for your heart. You're pumping 2 times the amount of blood volume through your body to support that pregnancy. In my case, I had pregnancy-induced hypertension, pre-eclampsia, emergency C-section, and postpartum eclampsia with my daughter, which no one told me is a risk factor for developing cardiovascular disease. I think then you move right into the perimenopause, and then you go into menopause. So you have all these changes, and they do structurally affect the arteries in your heart. So the fact that we haven't been studying women in that intense way at the different points in time in the different stages along their life, to the degree that we've been studying male hearts for much longer, there's so much to learn. So I do think that is one thing that really differentiates female hearts from men or males. And then yes, we do have smaller vessels. That's why microvascular disease is more prevalent in women and often underdiagnosed and understudied. It is a newer thing that we're talking about. So with those arteries, if you're having what's called an endothelial dysfunction in those arteries and vessels, the blood may not be flowing appropriately. It can cause angina or chest pain, and it can lead to heart attack symptoms. So it makes women feel like they're crazy because it's a really difficult diagnosis to obtain, often through very invasive treatments or procedures like angiograms or catheterizations, which was what happened in my case. Mm-hmm. They're starting to come out with technologies now. There's one called Visible that's in kind of this launch phase, like $55 million from the Gates Foundation, and Pivotal and Welcome Leap are trying to find pathways for women to not have to undergo all of those invasive treatments to get those types of diagnoses. And then the way a heart attack presents is differently
so important
in women from men. Are there similar things? Yes, absolutely. I can speak personally. I would have neck and jaw pain. I would be extremely short of breath, as I mentioned earlier. I did not have like a, hand on my chest, fall backwards moment like you see in a movie. I didn't fall forward on the floor. Would I have debilitating pain? Yes, but I could be sitting here having a conversation with you, actively having a heart attack. Now, It wouldn't be pleasant, and it would look like I am just like in discomfort. But, nausea, unrelenting fatigue, those are the types of symptoms that can make you think it's something else. And they tend to kind of loom and build as your body is trying to tell you like, hey, something's wrong. So it's really important, as we've touched on, that if you feel like something is off and it's persisting, and you've said this too, you live in your body every day. There is no one else that occupies the space. So when you start to feel that is off, I think it's so important to not rationalize or dismiss it, and to lean in and say, that's not common, that's not usual, and I should pull on that thread. I should look deeper into that.
I just want to double down on that, because even me, I've been in the health space for about 12 years. I've been a health coach for 7. And I just, this past October, really learned the differences in male versus female heart attack symptoms. Mm-hmm. So it's exactly what you're saying. A woman could be having a heart attack, and the symptoms she's having are jaw pain, a migraine, yes, nausea, dizziness, those feelings of anxiety or panic. Mm-hmm. And we would not even personally know that that's a heart attack, right? We would probably go to the ER, but we wouldn't know that maybe this is what's going on. That flag wouldn't go off internally. So even exactly what we see in movies, it's usually older male, mm-hmm, clutching at his chest, the shooting pain down the left arm, they fall, mm-hmm, to the ground, and everybody knows immediately that it's a heart attack. That's not the case in women. And again, I think some of those structural differences matter with the heart and how it's, how it is in women. But I just, really want to circle back on that one, because it's so rarely talked about. And I know you and I have spoken about, I have a family history of breast cancer, and it's something that is so dear to my heart as well. And we see so much advocacy around it. But heart disease is what? 1 in 3 women, yes, 1 in 3 women will die of a cardiac illness.
Related illness. Yeah, it is what we talked about. I was at a Susan G. Komen gala a couple weeks ago, and I heard the statistic that 1 in 8 women will be diagnosed with breast cancer, which is obviously a staggering statistic, and it's heartbreaking. I thought to myself, 1 in 8 will be diagnosed with breast cancer. 1 in 3 women will die from a cardiovascular related illness. I was trying to reconcile that in my head, not to diminish or, discredit the impact of breast cancer in our female health in our world, but more so to really understand the gravity of that 1 in 3 will lose their life. And oftentimes the first sign of cardiovascular disease is sudden death. And in even more cases, it is preventable if we are proactive and we seek the proper resources to address those concerns, and not wait until there's a problem to start asking those questions. So I don't know if that's the rabbit hole you wanted to go down, but I really, when we were in that room, I went around the room. I said, 1, 2, 3, 1, 2, 3, 1, 2, 3. I mean, that's that's powerful, you know, to
Yeah.
be in a room full of women and it's like grandmother, mom, daughter.
Yeah.
That's, you know, it's hard to think about that. And as a mom to a daughter, I want a world where she doesn't fear either breast cancer or cardiovascular disease.
Absolutely.
And certainly if there is something that could be prevented, like cardiovascular disease, I want her to do everything in her power and have all the information possible to not have to go through what I've gone through and so many other women go through.
So much of me wanting to even start this podcast is what I think of as closing the knowledge gap.
Mm-hmm.
That's all it is, because the knowledge is available. Maybe the research and the devices and things are right now up and coming, and we'll be grateful for that and,
Mm-hmm.
you know, stay on top of that. But so many things come down to early prevention and knowing the signs. And that's really just a matter of understanding, right?
Mm-hmm.
And just knowing and closing this gap that we have of things that we've historically maybe carried and thought, and like changing that narrative around what does women's health look like today, right? With what we know. It's like, I think of it as once we know better, we can do better. And now
if you can
thankfully,
name it, you can treat
if
it.
you can
I
name
mean,
it, you can
truly,
treat it.
like I agree with you. And so much of it is awareness.
Mhm.
And again, you know, as a woman who went through a complicated pregnancy and an emergency C-section, a traumatic experience,
Yeah.
where one of the major risk factors on the other side is cardiovascular disease, and no one ever said, hey, in a few years you should just follow up with a cardiologist, make sure that there's been no damage to your heart, or that, you know, if you do have a family history of this. And it's so fascinating to me. You know, I was scheduled to go see my OB a couple weeks ago, and I noticed that there was a mammogram booked on my appointment, and I haven't had one yet. I'm
Mhm.
37, and I thought we waited till we were 40 to get those, but
Right.
now they're starting to get them earlier, so you can have a baseline to go off of, especially if you have had a breast augmentation and things like that. And I was like, oh, I'm like kind of nervous to do this. And I've had all these other tests done and procedures and things. But I thought, gosh, I really wish that there was a cardiovascular health screening that came with this too.
Yeah.
Like, why? It is so common sense when this is the number one killer of women that it should be connected. But the worlds are so separated
Yeah.
that I that would be my dream for women, is that at their annual visit, not only are they getting, you know, gynecological things checked and their breasts checked, but they're also getting their hearts checked proactively, because that is the one place women do tend to really show up for themselves every year, is the OB-GYN. And so it's a bit idealistic of me perhaps, but it is a pretty common sense vision to try to manifest in the world.
Well, after I heard you speak in November, I went and got an EKG.
EKG?
And it was my first one, and I'm 35,
Yep.
and it showed nothing concerning, but that was just something that I felt moved to take action on after hearing you speak. And at a minimum, even if nothing is wrong right now, I'm passionate about spreading the word about getting the right tests, because now we have a baseline. So now if something changes this year, I have this test that was run, I have the results to compare to, right? This is the case with blood work.
Yes.
I always tell people, men and women, that we want to know our numbers. We want to get that checked at least annually, even if things are going well, for that baseline checkup, so that if something changes in 6 months, we can compare and see what was different. So even if you're healthy, right, it's something that you want to do, of course, within reason and taking into account family history. But I so agree with you that like the more comprehensive understanding we can get around like the GYN visits and what else we could be doing, the better. And I wanted to also ask about the role of intuition with just this whole journey that you were on. Intuition is big in my world with the work that I do with breath work. And I think of my work in mind-body health as a bridge for women to start to connect with their body and their intuition. I think we're so head focused, so analytical, smart, driven, right? Amazing, goal-oriented. And sometimes that disconnection below the neck is present in many of us. It was the case for me in my 20s before I found my way into the space of health. And so for you, your intuition through this journey, what did you notice? How does it like speak to you maybe? How does intuition present itself to you?
It's really funny because I was just having a conversation with one of my best friends, Catherine. It might have been yesterday. Yeah, it was yesterday, about intuition. And I mean, it shows up everywhere in our lives. And she was kind of telling me something that she does whenever she's trying to get in touch or check in with her own intuition. And she's like, I just put my hand like on my stomach and on my chest. And I just kind of like, how does this feel? Like, how does this make me feel hearing this? How does it make me feel reading this? How does it make me feel speaking this? Whatever it may be, right? But asking how it feels to be receiving whatever that signal is. And I think if I reflect on that experience that I've gone through with my heart, I really did trust myself. It was my head that was the problem. My body was giving me all the signals and I trusted my body, but my mind was like, it was like the overthinking. I would just ruminate. And I think that when it came time for me to really stand up, it was born out of a passion for my worth. I matter. I felt that was really what I was trying to communicate is I matter. What I'm saying matters and I need you to hear me. And I don't know, that's really not my personality. I think I have an authority and a presence about me, especially with work, but I'm a bit of a people pleaser. And it got to the point where I believed so intensely in what my body was telling me that I was completely equipped to say, no, you will listen to me. You will hear me. And that is ultimately what saved my life. I did not just accept the things that were being told to me because my body kept reminding me, you're not crazy. You're not wrong. I'm going to keep giving you these signals. And now I've learned that there's really never been a single time in my life that my intuition has been wrong about anything, whether I recognize it in that moment or not. But even in just reading a note or a message from someone and the way it might make you feel
it.
You can feel how your body is signaling something to you. And it might not reveal itself till later what that thing is. I think there's a difference between trusting people and having intuition, right? I think that's a different conversation. But how your intuition is serving you and making it about you and not about the other people, I think is a tool. Like, okay, not what is this saying about them? What is it trying to tell me about myself? I think is a really good reflection.
I love that. That's so well put, that our intuition never steers us wrong. I really do believe that as well. It's just the filters that we put on top of it and try and rationalize it. And, you know, something you had shared with me is that most of the time when a woman shows up to an ER or for a doctor's appointment, it's the last place she wants to be. And my thoughts on that is we've probably rationalized our way out of going, right? So when we're there, you better believe that this is really kind of like a last resort, like something is actually very wrong. Women especially, many women in my life, I don't know anyone who is doing things for attention or because, you know, they have nothing better to do. If we are asking for help, something is critically wrong because of how high our resilience is. And I see this in all the women in my life. Our pain threshold, our discomfort threshold is so high. which is also important to mention for anyone who's listening and maybe you've been living with stuff for years or a decade and you're like, oh, I think that's just what's so. No, we want to really know and get to the bottom of this. This is something I'm passionate about with menstrual cramps. We're not meant to be living with them. And I really discovered that when I went to Ecuador, when I looked around to the indigenous women and how they were treating pain symptoms and like herbs and just natural remedies. And I was asking them, like, do women here suffer from a lot of PMS or PMDD or like hot flashes with menopause? And they're like, no, we just have herbs and things that we do. And, you know, we supplement in different ways. Maybe you eat differently postpartum and you have like more chamomile and anti-inflammatory things that help your body heal. But I think it's so important because I think especially in Western society, we are so resilient, so driven, and also we're so conditioned to live with this high amount of discomfort when that does not have to be the case. Like, ladies, we have to start speaking up.
I couldn't agree more. And one of the moments that I remember so distinctly was from last August. I woke up around 3 or 4 in the morning with chest pain, which is typically around the time that it would show up with the coronary vasospasm, because you get an adrenal surge like in the early morning hours to prepare your body to wake. And that is kind of what triggers my spasms. And I keep nitroglycerin tablets by my bed because those are the things that I put under my tongue that dissolve. And then if I take 3 of those within a 10-minute period and I cannot get the chest pain under control, that's usually an indicator that you might need to go in. I also have a nitroglycerin patch that I can put on my chest, which if that also isn't helping, like, okay, you've done the tablets, you've done the patch, you're still struggling. I was lying in bed contemplating, like, do I call an ambulance? I've done these things. It's not helping. I don't want to freak my daughter out. And if I could just get her to school and if I could just get the dog to doggy daycare, I'll see how I'm doing. And I got up. I made my daughter's breakfast. I made her lunch. I loaded her and the dog up in the car, did my regular child and my fur child drop off, and I drove myself straight to the ER, called my doctor on the way. I left my car running with the door open and couldn't walk inside the ER by the time I got there. And I had a doctor in there. He's like, what are you doing in here? You're too young to be here for this, you know? And he's like, you're a medical marvel. Like, literally, you can't even get an IV in me right now. You're throwing every pain drug at me, and I'm sitting here telling you, like, I'm having a spasm attack. Like, I know what this is, you know? But yeah, there's anywhere in the world I would have rather been. And the amount of discomfort I had to get to even show up, because I also knew that if I wasn't actively having a heart attack, I was probably going to get sent home. Yeah. And so, yes, 100% women are conditioned to walk around uncomfortable and in pain. And that is on us to really address in ourselves of why am I rationalizing this? Why can I not take an hour to pull myself over to the doctor here, you know, and schedule that appointment and make sure that everything's okay. And it's really because we also generally can be people pleasers and we don't want to let other people down. We carry a lot of responsibility and it's often hard to ask for help. That is an expression of trust. And I think it's a hard thing for me to do and a hard thing for both men and women to do, is to ask for help. But it's a lesson that often is hard learned.
I see so much of myself in you, and there's so much I want to say. We have time for one more question, and okay. I really want to wrap with any actionable things that women can do hearing this conversation, and maybe what's something that you want the woman listening to this to know as an outcome of this.
So I'm going to give you a few tangible action items that women can implement right now if they want to take proactive steps in their cardiovascular health. And I talked to Dr. Giesler about this to make sure that I was steering everyone correctly. The first one is to know your numbers. I know you preach that. Your blood pressure averages, not just take your blood pressure one time and think that that's your baseline. You need to kind of take it a few times and take it regularly so you establish like what your averages are. And then your cholesterol levels and blood sugar. And you should make these readings a part of every well woman exam each year. So that's kind of one thing wrapped up in point one. And then exercise being your test. If you are struggling, especially in a new way to carry out exercise the way you have been, that is a signal to get checked. And then if you're not being heard, if you're not getting the answers that you're seeking, if you feel you're being dismissed or, relegated to you're just anxious, find a new provider. You are not crazy. And if it is helpful, bring a friend, a trusted friend or a loved one with you to your appointments. It can be a huge change maker in those environments, because if you're nervous and distracted and trying to absorb all this information, you might not always be your best advocate, but someone who loves and cares about you can speak up and say, hey, can you slow down? Hey, can you repeat that? Is that the only option? What do you mean? You're sending her home. And to just have another person in the room with you could make all the difference. And it certainly has in my case.
That one's so important. I had not even thought about that because I'm single as well right now. Yeah. My parents are in a different city, and maybe establishing that level of care with the girlfriends in your life, at least, like who can be there for one another, right? To step in and be there in these types of situations.
Yes. My girlfriends have all spent a night with me in the hospital at this point, and they're incredible. And having that village to support you no matter what your circumstances are, and being honest with yourself and with other people if something is going on with your health. Not trying to hide that from people who care about you, I think is hugely important. And, it's one thing when you have children, there's a whole other conversation around that and how you talk to your kids about illness and things that are happening in your body. But it's been something I've had to deal with my daughter, and I've learned a lot through that and how it affects children. But really allowing yourself to be cared for by other people. If that's kind of the thing I would leave everyone with today, is open yourself up to letting someone take care of you and be there for you, because I know we're all doing a great job of showing up for everyone else, and we deserve that same, love and appreciation on the other side, and the support, because you really can't do it all alone. And trust me, I've tried. I've tried. It's probably been to my detriment and caused me some added stress over the years. But I've learned how to trust other people through this experience and to show up for me.
Thank you. That's such a powerful wrap up, because so many of the women I know carry so much. We do so much. We are there for everyone, and we really take care of ourselves last. And I'm interested in how we can flip that and know that if you put yourselves first, everyone else downstream from that benefits, and really flipping the script of asking for help is not weakness. It is a sign of strength, usually signified by how much you have been putting up with and how much you have had capacity for up to that point. So really recognizing it as that sign of like courage and strength and bravery. To be able to seek that. So thank you so much.
Yeah, thank you.
I will link in the show notes, so your information, of course, and Bespoke Advisory for anyone who is, in the philanthropic space. Dr. Giesler's information. So she is a cardiologist here in Austin in private practice, who was also on the panel with you. Yes. So
the Heart Center for Women.
Heart Center for Women. So she seems to be an amazing resource. And our goal with this episode was really just to help at least one woman get checked, maybe get the right answer. So if you're listening to this and you just want to share it with another woman in your life, your mom, your grandma, someone your age, someone younger than you, this is about opening up this conversation to women of all ages, because again, right, it could really save someone's life. So
yeah, that's the hope. And if anyone has questions, I am an open book, and you can reach out to me, email or Instagram, whatever works.
Amazing. Thank you so much.
Thank you for having me. This has been so fun.
Thank you. Thank you for tuning in to the Exhale podcast. If you love this episode, share it with a friend and leave a quick review so other women who deserve to know this information can discover it. If you've been searching for resources to support your health, hormones, and stress level, you'll find the information to join our Austin-based or online community in the show notes and at womenwhobreathe.com. You can also find us at the.exhale.podcast on Instagram. The community is for smart, successful women who want to recharge, and you'll find courses, recordings, and live breathwork sessions. It's open for women from all over the world, and I hope to have you breathe with us soon.